listening, loving, curious,
I only like
history, business, biology, Garland Peppery, some story.
How are you?
Garland Pepper.
Let me introduce myself. I'm Gary Fox. I started a podcast called Garland Pepper. Garland Pepper Presents. And so the presents part is whoever I'm presenting is the person being presented. And today, this is you. Ladies and gentlemen, welcome to the Garland Pepper Presents podcast. Today, my guest is Dr. George Greer. Dr. George Greer is a psychiatrist, psychologist, psychiatrist.
Psychiatrist, MD.
Psychiatrist MD who studies psychedelics and they are doing some amazing research at the Heffter Institute, where they are studying different psychedelics and in different ways that are really amazing. And this is a subject that's been interesting to me for a long time because I have depression and I suffer with addictions, and they're working on both of those things. So they're very interesting subjects to me. Could you tell me a bit about yourself? Where did you begin? Yeah.
I began in Port Arthur, Texas in 1950.
Yeah. 1950. That was a while ago.
It was a while ago. Yes.
Oh.
Yeah.
So,
So I grew up in Texas. In my freshman year at Rice University, I had an intuition. I wanted to go east to college. So I went to Vassar College and had some important experiences that led to my interest eventually in professional psychedelic treatments and work, and studied religion, psychology there, philosophy, social sciences, pre-med, et cetera. And then medical school back in Texas, University of Texas, residency in the Bay Area, which was active with transpersonal psychology and starting to talk about the psychedelic treatment that Stan Grof had done and that in the late 70s. Mid 70s, I spent 6 weeks at Esalen with Stan Grof, Joseph Campbell, Wheat Shoal Shaman, and got a in-depth exposure to indigenous and Western, psychedelic therapy.
and you're doing this with the great mythologist.
I'm sorry?
You're doing this with the great mythologist, Joseph Campbell.
Yes, yeah, it was amazing. Joseph Campbell was there for a week. Got to have breakfast with him and talk about the weather. Stan Grof, Leo Zeff, who became my mentor. There's a book about him called The Secret Chief. He was my roommate there. But it was a radical thing as a medical student from a Texas medical school, any medical school, to go to Esalen, where, to exaggerate a little, everything you learned in medical school is wrong. We'll just kind of start there and give you an alternate view of
They're doing
it works.
mind-body work there at Esalen.
Mind body work, Gestalt therapy. Yeah, it was amazing exposure for someone 25 years old. And so that's when I really got interested in working professionally with psychedelics. And then when I finished, Grof introduced me to Ralph Messner, who suggested ketamine work, which I did for a few months, and then heard about MDMA, which Leo Zeff was using, and found a legal way to do that. As a doctor, I could make it, manufacture it, synthesize it myself in a lab, and give it to my own patients without having to ask anybody permission. So that was kind of a loophole people hadn't figured out. So I made it with Sasha Shulgin in his lab and gave MDMA for about 5 years.
So MDMA, you're really one of the leaders in studying MDMA.
Yeah, well, my wife, she was a psychiatric nurse. We published the first paper on giving MDMA to people in a therapeutic kind of setting. They weren't there for serious mental problems or serious issues because it would be too risky, but just personal growth mostly, or dealing with neurotic things. So I had the only completely legal supply, above ground supply. I think there are a lot of therapists doing it then, but they had underground supplies,
right?
Not because a doctor or a pharmacist could do what I did, but only give it to their own customers or patients. They
Right.
couldn't just sell it. Then you're like a drug company. So that was great. We gave it to about 80 people or so. No serious problems, maybe some anxiety. Some couples said they really helped them establish intimate communication more directly than before, and that communication persisted up to 2 years later. And that when we did follow up for everybody who was a couple. So that was our, I guess, unique finding, though not a surprise. It was a unique finding.
So
we weren't dealing with PTSD, depression, anything serious back then at all. It was more personal growth. Meditators came by word of mouth. Most people with some sort of spiritual orientation. This was in San Francisco and then here in Santa Fe.
uh-huh. Both of those are kind of spiritual seeking zones.
Yeah, right. Uh-huh. Yeah.
So I've always been interested in this. I mean, I listened to another podcast, and it seemed to me that you had been integrated with a lot of the people that I've been looking into for years, Joseph Campbell being one of them, Richard Alpert, and then later Ram Dass, and I don't know that you mentioned Leary, but I know that there's always been this kind of challenge between the medical process and doing actual healing and exploration of psychedelics, and then the kind of fun or the exploratory, playful side of it. And I guess the best metaphor for it, and actually it was a true life metaphor, is, Ram Dass and Timothy Leary trying to do a thing in New York, and then, Kesey rolls up with the Merry Pranksters and, kind of throws that blemish on them. And so there's always been this challenge between the medical field. It's to get legitimacy outside of that.
Mm-hmm.
So how has that impacted you?
Well, I am a medical doctor, so I guess I never thought about it impacting me. It's more like, how does gravity impact me? It's just a given to existence. This is the way the world is. So
yeah,
without knowing what it would be like in a different universe, it's hard to know how that would have impacted me, that. But I would say that, well, certainly the laws were a constraint, and I had to stop giving people MDMA because the DEA made it a controlled substance.
Mm-hmm.
So that obviously impacted me.
Right.
But it was obvious from even before starting that it was inevitable that MDMA would become a controlled substance. So that was something we fully expected, because it's a mind-altering chemical, and it generally feels good.
Yeah.
People are going to use it. It's going to get on the street, which it did.
Seek that out.
Yeah, so that was not a problem, but it did affect me. If there had been other framework set up for physicians to administer this medicine, not being a controlled substance or a different scheduling level, lower level, then that would have been different. But I don't think of that as something that there was any option for it not to happen.
It's just going to happen.
It felt bad. It was tragic. It was sad. Camelot was over. But then later, so that in '85, then in early '90s, Dave Nichols formed the Heffter Research Institute and asked me to join that as a co-founder. So then I was more managing research, managing research projects, managing the institute, finances, operations. I wasn't administering any drugs or medicines myself,
Mm-hmm.
but sort of like the movie, like sort of an executive producer level rather than a director or actor level. More the business end of it, and getting it done, getting the reviews done, the scientific reviews, so it can be really good quality publications from the work that we're funding, and then working to raise the money and pay for these studies at various medical schools. So I've shifted more from the 80s, giving people MDMA to managing, administering psychedelic research since the last, 27 years.
it's moving along quite well, I think.
Yeah.
Society is starting to come to a different place,
Mhm.
which I think is beneficial to you.
Yes, absolutely.
So where are we? So your existence really is FDA regulated. Everything you do has to go through that.
Yes, right. Yes. So I'm not, there are these ballot initiatives. There's one in Oregon that looks as good as it can be. Yeah, but all my work as a licensed physician and as an official of Heffter, yeah, it's all completely within the legal FDA, current existing legal framework,
Mhm.
locally and nationally. So we haven't needed to change any laws. It would be easier, it'd be smoother if there was less red tape and hassle to doing Schedule 1 drug research. But that is really a pretty small part of the overall research effort. I mean, it might add some months waiting to get that approval, but
Yeah.
it doesn't change the amount of money really. It just changes some of the time. But that would be facilitated, but it's certainly not necessary because all this research has happened without any laws changing, the last several years, which is very exciting.
I was listening to you on another show, and you'd mentioned that the real differing factor between a good experience or a bad experience is the purpose within which you go into the experience and explore.
Yeah, I would say that's the main factor, the purpose, the intention the purpose has. Say, I want to, have fun at a music concert or a festival, or I want to recover from addiction or PTSD or depression. Completely different mindsets, and which completely affect the experience, and also obviously the setting. If you're in a room with a therapist or a guide, that's different from being at a public event where a lot of strangers are there who don't know you or anything about you.
Right.
Yeah, so that's that was known, I think, before, but Leary really popularized that, the whole concept of drug set and setting as the three main factors of the experience. Leary really promoted that concept, which was useful, though it was not, he didn't invent that concept, I don't think, but it's still a totally valid concept that all of us use in research and psychedelic work.
Yeah. So it's been effective. I mean, you imagine you've honed your tools over the years. So let's say somebody comes in and they're suffering from some sort of post-traumatic stress, or they're scared they're going to die because they have cancer, and they're freaking out. And, I was reading that there are some sessions that take a couple sessions because they don't work through all this stuff. What does one of your therapists do during this process? I notice it's a lot of sitting and waiting, but what if somebody's having a traumatic situation? How do they intervene with that?
Yeah, so take a few minutes. MDMA is, well, first of all, at present, today, those sessions legally are only taking place in a research, as part of a research study at a university in this country. And so there's all this incredible research preparation, screening the person, administering all these psychological tests to make sure they're not at risk of a psychotic break or whatever, any health risk, blood pressure. So I have a lot of attention before, and then some hours of just counseling preparation for that pretty much day-long psilocybin or MDMA session. It's called the preparation phase, which is usually more than one meeting, 2 or 3 meetings, a couple of hours. Then there's the all-day session day, and I'll come back to that. Then there's the integration sessions, which can also be hours to help the person integrate their insights, their emotional shifts, their perceptual shifts, their big picture shifts about who they think they are and what their purpose is, to integrate those into their everyday life and help them improve their functioning in relation to their addiction, depression, trauma, whatever. So that's the procedure. Now, during that long session, it's very different between MDMA and psilocybin. MDMA, at the doses given, 100, 125 milligrams, does not really interfere with logical cognition. thinking, reasoning, conversation, communicating. In fact, people can become very talkative with MDMA because it has a sort of a stimulant property. So the training, the therapy training that MAPS does for MDMA is very extensive because there's a lot of talking, a lot of patient interaction, helping them, verbally through re-experiencing, reframing, emotional releasing their initial trauma or traumas in most cases. So lots of verbal interaction, lots of subtle therapy going on. So, doing psychotherapy with someone on MDMA is very, very different from someone who's not on any psychoactive drug. So there are a lot of training, many hours of training for that, which is appropriate. And I'm involved in that. I've taken the training. I will be, once the pandemic is softened out, be administering MDMA to therapists in training to have their own experience, on the client end. Yeah. Psilocybin, very different because during that session, the peak of it, people are not really verbally, cognitively competent to engage in an intellectual dialogue or conversation. I mean, they can say, I'm scared, I need help, or they can, basically describe their experience in a few words and let the therapist know how they're feeling, what's happening, if they're struggling, whatever, I need to go to the bathroom. So during psilocybin sessions, mostly silent, some the entire time. But in the cancer studies, like at Hopkins and NYU, I think about a third of the people had significant anxiety at some point during their psilocybin session. And these were all cancer patients, facing death. And so probably it was a lot around that, but not always. And the therapist, part of their training and then their experience as they've done this, because some of these therapists have done hundreds of sessions, like at Johns Hopkins and in Zurich, et cetera. So it's just general support. It's not rocket science. It's just one of the things Leo would do. He would just grab the person's hand to sort of ground them in their body, like you're in your body, I'm your body, I'm here, you're not alone. Uh-huh. That's very reassuring. So they're just pretty much standard, breathing, breath relaxation, body scanning, visualization, relaxation techniques are used, and just personal support. And all the therapeutic alliance relationships has been established in the screening and the preparation. So the client has, at this point, there's a lot of basic trust between the client and the therapist. And so in those cancer studies, basically all the participants got through that anxiety by the end of their session. So at the end of their psilocybin session, they were okay. So that's the difference, and that's sort of how it goes, in a nutshell.
Pretty long-lasting results.
Yes.
I've noticed.
Yeah, for these, yeah. So you talked about sessions. So in the cancer studies for anxiety and depression, they had one session. In the current alcohol addiction studies, they're having 2 sessions. In the pilot study for smokers, just 15 people, no placebo, they had 3 sessions. Now in a placebo study, the controlled study, they're having just 2 sessions at Johns Hopkins because their results were so good with 3, they didn't feel they needed 3. But it's more expensive to do more sessions. Raises the cost of the study tremendously.
I think I was looking into those sessions. Now, the placebo was a microdose or a real dose, so they had a feeling, but not the actual.
Well, in the cancer study at Hopkins, they used a microdose, and they had to lower it, I forget, from maybe 3 or 1 down to half a milligram because people experienced consistently something with their sort of low dose. So they lowered it, so they experienced really nothing from the dose itself.
Yeah.
In NYU cancer thing, they used niacin as a placebo, which causes flushing, some physical symptoms.
Sure.
The current alcohol study, the placebo is Benadryl, so it gives people a high dose of Benadryl, so they feel altered, kind of dreamy, maybe sedated. So they know in other words, they know they got a drug.
Right.
It's just not psilocybin at all. Yeah. So different different placebos are used in the past. An older study of normal people, Ritalin, I think, yeah, Ritalin was used as a placebo. It's a stimulant, for ADD.
Mm-hmm.
So different approaches are used that way for the sessions and placebos in research.
Those are really good.
What's that?
The smoking cessation numbers are really pretty high.
Yeah, so the pilot paper came out a few years ago, 15 people. I mean, there's the graph, it sort of, here's their level of using cigarettes. It just drops to zero. It's just like they just quit. And, after, I think it was a year follow-up, most of them are still in remission. And, success rate, I mean, 2 or 3 times that of the best other success rate with, say, Chantix, the gum, nicotine, therapy. Yeah, so it's only 15 people, and generally in studies, when you do later larger studies, the statistics are less dramatic with more people.
Yeah.
But still, it was just off the chart, for success and lasting. After these, 3 sessions for smokers. For the cancer patients, they had all this hours of therapy, 1 dose of the drug, and their anxiety and depression significantly reduced for the whole 6-month follow-up and a little beyond. So yeah, really unprecedented in psychiatry to have a single treatment that lasts so long. Like if you have surgery, if you have surgery and they remove your tumor and you don't have cancer, you're cured, essentially. You can go back. With electroconvulsive therapy, shock therapy, that's really the only other interventional treatment in psychiatry, but that's maybe 12 to 20 sessions. It's extremely effective for depression, the most effective, but very expensive, very involved. You have to have an anesthetic, blah, blah, blah. But there are really no other procedures in psychiatry that have shown, or drugs that show lasting results long after there's no drug in the person's body.
And that's psilocybin.
Psilocybin and MDMA. Yeah.
MDMA also. So
yeah, for PTSD.
So MDMA almost is like you're going back to the talking cure, but it's hyper.
Yeah, it's boosted. MDMA, it reduces, what we called it back in the 80s was it reduces or blocks the emotional, it blocks the nervous system's fear response to a perceived emotional threat. It's just hard to be afraid.
So would that place between the amygdala, what is that?
Well, the amygdala does a lot of things, but it is the sort of the center where the experience of fear is initiated in the amygdala. So the amygdala, in recent years on scanning, the amygdala is quieter when people are on MDMA.
Is the
hippocampus during that?
Is the hippocampus more vibrant and able?
I don't know. The hippocampus, it does a lot of things, and it's very small. I don't know. I'm not a neuroimaging expert. I don't try to store in my memory all the parts of the brain that are affected by these, because different studies show different things. And but it's what's been said a lot is the networks in the brain. You've heard of like the default mode network. These networks with psilocybin are definitely altered, and in ways that, in some ways, similar to meditators who have fMRI scans for networks. And studies with meditators have shown with psilocybin that their these are long-term meditators. Their meditations improved in the weeks after they did it with psilocybin. It sort of helped them, anchor it maybe. So there is a connection with psilocybin and mindfulness type meditations also.
Yeah. So you're passionate about this. It's obvious, and you've given your life to it.
Yeah.
And I imagine it anchored when you were doing the MDMA tests. Were there certain things when you first started doing testing with people where you're just like, this person came in a miserable wretch and they left just a much better, and it just kind of flipped your thinking on the whole thing?
Well, we didn't see anybody who was a miserable wretch. We would consider them too
Volatile.
disturbed or mentally ill or too at risk. Because at that time, there was the only published human research on that was, I think, one sentence in a paper by Shulgin and Nichols that said MDMA evokes sort of a therapeutically friendly state of mind, something like that. That was it. And then Leo Zeff had been using it for a while, but only with, healthy, pretty well put together people. So, we were extremely safe. We thought of every negative thing that could possibly happen. You might get a divorce, you might go crazy, you could have lasting problems. And we thought if that scares them away, that's fine, because this is not a time to take risk with this brand new drug outside of all the FDA stuff, because it was hardly been used in a few hundred people at that time.
Yeah, that's a little scary going into something like that.
Yeah, so we were just super, super as careful as we could be, screening, especially around blood pressure, medical issues, psychiatric. If anyone had ever been disabled by a mental problem or emotional problem, even if they didn't go to the hospital, we did not give them MDMA.
Okay. So now they're looking at using it, and I think the VA is using it.
Well, the Bronx VA, MAPS just announced the Bronx VA is going to be doing research with it, and that will be the first VA to use MDMA in a VA research project.
Okay.
Yeah, that's about to get going now. It's just in the MAPS newsletter. Do you get the MAPS newsletter?
No.
Oh, yeah. You can just go to MAPS and sign up for their newsletter. It has a lot of great information. So, yeah, it's going to be starting pretty soon, I think. Well, depending on the pandemic and stuff, I assume.
Mm-hmm. You've got some big hitters out there sponsoring mushroom treatment therapy financially. The one that comes to mind is Tim Ferriss.
Mm-hmm. Yeah.
He's involved because he has suffered from depression, which is actually what brings me in here. I mean, I did Wellbutrin for a while. You mentioned that earlier. And, it's okay. I didn't quit smoking.
Okay.
But I felt okay about smoking then. I didn't feel as bad about it, So,
okay, right. Okay.
But I also felt like I was in a fog. Like I wasn't present as I could be in life at some level. And it was hard to define because you appear to be present and you are engaged.
Right.
You that seemed kind of disengaged.
Mm-hmm.
I don't know what that was.
Well, depression does that. I mean, depression, there's being sad.
Yeah.
And depressed people can be sad, but depression is generally a sort of an absence of emotion, an absence of interest in things.
Right.
An inability to feel joy, just, pure joy. And so people are emotionally more flat, in more the negative flat. And the high doses of SSRI antidepressants can also make people emotionally flat, but in sort of a neutral flat place as opposed to a depressed flat place. But there's been some research to show that in the brain, what psilocybin is doing in the brain in regards to depression is more activating compared to sort of the flattening or damping down symptoms that come from the regular antidepressants. Mm-hmm. So the psilocybin is not sort of suppressing depressive symptoms. We think it's changing some of the basic neurophysiology that causes depression, but because the recovery lasts so long, and most people think it's partly biological, we don't know how much, and partly psychological, because a depressed person, you have these negative tapes that just repeat interminably, and the psychedelics just physically kind of stop that, and it does correlate with the default mode network. But you talk to neuroimaging experts, it's like it's not that simple, it's not just default mode network equals your tapes in your head. It's not that simple, but the mind does get quieter, and so people are able to have thoughts outside their own personality box. Think of themselves in a different way, as opposed to, I'm not a failure, I'm not an addict, I'm a blessed human being, I'm saved or whatever. And that we think has important. And alcoholics, hitting bottom, spiritually hitting bottom in alcoholism.
Yeah.
People have a spiritual awakening. So it's very parallel to that. And so with more research, we'll understand, maybe tease out the neurophysiological, psycho-spiritual things. But that's, that's what's fascinating, because it's a mystery about what are we essentially as human beings.
Right.
It gets to those really interesting questions, which is part of the passion people have in this field.
Yes.
Yeah.
Seems like a never-ending question. I have the same question
Right.
myself all the time. I don't know what I am. I don't know what this is. I'm at some level, I'm confused as to where I stop and where it all begins and ends.
Yeah. Well, join the club.
Oh, good. So,
I mean, I think a lot of the problem is a person can, like, say, in the peak of a psilocybin mystic experience, they're just one with divinity or God or whatever you want to call it.
Yeah.
And, there's no words there. It's an ineffability. You can't put it in words. And then when people come down and their personality comes back, their mind starts working, then the words just, our minds just create these words. We can't help it. The words start happening, start labeling things.
Unexplainable.
Yeah. And the words start labeling things, and it becomes differentiated from undifferentiated. And so people, in this field, we all know this, and people who've had a lot of experience know that. But I mean, you and I are talking now.
Yeah.
If we just stared at each other.
Yeah.
I mean, we'd probably get bored in a while.
There's no story.
Like, oh my God, this is amazing. I see God in your Zoom face,
I see God.
So talking is important to connect.
So it's healing, and that's what you've chosen as a profession, and you've chosen an unconventional way to go about it. And the reason is because you've seen results throughout your life.
Yeah. Like I went to, early on, I went to, I guess I went to three of Leo's groups, about 10 people having different medicines, all day long, Friday night prep, Saturday medicine, Sunday integration. And, and personally went through some very healing experiences, but saw in other people in the group go through some just amazing psychological, emotional, spiritual healing that never saw anything even remotely close to that in my psychiatry training. And even, at Esalen, there was a lot of, big emotion releases and breakthroughs from their techniques, body work and stuff. Which was more impressive than I would learn in just standard psychiatry. But still, with the psychedelics, it really took it a level further. And, a whole weekend, spending all day, and a group of people that largely knows each other in a group setting, very supportive, and just feeling loved and accepted for whatever goes on. People going to really extremely difficult, dark places, getting stuck and lost, and then exalted spaces. So that was quite an eye-opener, and just made me even more feel committed, like, hey, this is something to do. And in fact, I did that. I was thinking, at that time, should I become involved in psychedelics, the MDMA thing? And so went to Leo to sort of answer that question. Is there some potential here in psychiatry? And the answer was like, duh, of course, it's amazing. Mm-hmm. And I just, I think I did what anyone would have done in that situation. I just happened to be in it. I was the only psychiatrist in the group at that time. Yeah.
Figured out places connections are up, and sometimes it's just being in the right place at the right time,
right
moment in history where this is happening, and you meet the right guy, and there you go. Now you're both like, you're rolling in a whole new world. With an old school moniker, doctor.
Yeah, right.
And that's a nice sandbox.
It is. It was pretty great. Yeah, no government, no permission. You just had to be safe, careful. And I had a peer review group, blah, blah, blah. But yeah, it was, I made MDMA in Sasha's lab, and, 2 or 3 weeks later, I'm giving it to somebody. And then now, 35 years later, after we had to stop, well, 40 years later after we started, MAPS is still getting permission to use it for patients. You know, they're getting close, but it's going to start next year treating patients.
It's ringing. Sorry.
But wow, how that's pretty darn different. 2 weeks versus 20 years.
Yeah, it is. It's very different.
Yeah.
So,
but I understand all that. You know, you get a lot of people, you have to be safe. And so I'm not complaining about it. It's just, that's just, you know, that's the world we live in and how long things take.
it does take a while. It did.
And a lot of money. A lot of money is a big part of it, tens of millions of dollars. Yeah.
Yeah. So where's the most interesting research happening?
Well, my opinion, interesting. So interesting, that's an interesting question. So Heffter does two things. We do research we call basic science in normal people. How does the brain work? How does psychedelics affect the brain and subjective consciousness? And we also do treatment research, treating patients who are suffering from depression or addiction or obsessive compulsive disorder or AIDS or whatever. So I would say in the treatment area, the most interesting is definitely addiction, because number one, addiction is such an enormous public health problem in this country, especially alcohol. And it's so big, people just forgotten about innovation, you know, and the establishment research funders, National Institutes of Health, are not funding that as a treatment yet. But I think they will. So, but the results, if they're, you know, half as good as they've been or a third, are going to really change things. And so eventually you have people in these rural areas that really, you know, small town rural areas that really suffer from alcoholism, methamphetamine, you know, opioids,
Yeah.
and don't have access to medical care or good insurance. If those people start receiving and getting, you know, cured or recovering from addiction with psilocybin, their families and their friends are really going to take notice. And that's going to really, I think, change people's opinion to see these medicines as medicines rather than drugs that damage your brain. Yeah. You know, and that, because that, you know, someone you see a family member or yourself having a new quality of life, that's way more impressive than anything you read in the newspaper or watch on TV. Mm-hmm. So that's going to change, I think, the public outlook on that. Now, in terms of interesting and basic science, which kind of relates to patients, actually, the most interesting thing to me is something it's sort of on hold right now, but looking at, let me back up, the method for therapy for psychedelics has been the same for 50 years. It's Stan Grof pretty much devised. Headphones and eye shades, and just surrender and go with it. Okay. No matter what your problem is, it's all the same for the session itself.
And be in room with safe people.
Yeah, right, yeah. So now there's the idea to take therapies like sort of brain exercise therapies or computer learning or whatever, and do those under the influence of psilocybin, because all psychedelics and psilocybin promote neuroplasticity or rewiring, you know, breaking dysfunctional nerve connections and making more positive functional connections stronger, and making the negative ones, you know, like drug craving connections, I want cocaine, making those weaker by doing things on the drug that do that during the drug state. So that is very fascinating, because that would be the first time a psychotherapy thing with psychedelics has come from data from experiments, you know, physical experiments with people. So they'll do it with normal people first, and then people with those problems. Like, and one of the first things they want to do is addiction. People with alcoholism, can we help them, you know, not remember wanting to use alcohol? You know, forget those patterns. Oh. And use more patterns like I'm successful, I'm not guilty. Guilt leads to alcohol use often, which just, it's a, you know, negative spiral. I'm guilty, I drank. I drank, so I'm guilty, blah, 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 you know. So that's exciting to me. And then there, I'm not so up on it, but just studying, you know, what does psychedelics affect consciousness? And consciousness researchers like at University of Wisconsin and Christoph Koch in the Paul Allen Center, and his name will come to me at University of Wisconsin, or they're consciousness researchers primarily, you know, but now they're starting to want to use psilocybin as a tool for them to understand consciousness in the brain. And, you know, the hard question of consciousness, I mean, how is it that we have awareness and we have bodies, and, you know, I can just, how do I do that?
Yeah.
Nobody
Told her
who knows.
trying to do that, but
I mean, some people say the urge to do it happens before the thought to do it, but who knows? So that kind of research is very interesting. It's not something I know a lot about, but philosophically, it's very interesting and could have some important, you know, findings at some point.
yeah. It's when you start getting into that level, it's hard to measure stuff.
Very hard. Yeah, science can only involve things that can be physically measured, and you can take people's reports. They can all say the same thing, then it's scientifically valid on psychological tests. But, you know, a physical measurement, we just don't have, you know, the physics or engineering is just not developed. There's so much more going on that we can measure. That's a really excellent point.
You can measure outcomes of an experience, though. Like,
yeah, you can measure. You know, someone fills out a psychological test and they have a score. And that's quantitative, and it's measured, even though it's a subjective report, it's like measurement of what they said, of their behavior. Yeah. So, and that's considered valid.
So I've been hearing a lot about couples and you know, people getting MDMA and getting together with a friend who they trust and doing couples therapy. And I've heard good things about it.
Yeah.
And what's been your experience in?
Well, that was the thing we found was most common in our first papers, was that the couples who did it, you know, felt this communication persisted for a long time, and that was a surprising. Though that's something that my wife and I experienced ourselves, that we were able to just say things more directly that would be maybe embarrassed or afraid we'd hurt their feelings or something, or be too vulnerable. Just like, there's nothing to be afraid of, you know, just cut the BS and just say what's on your mind. It made it a lot easier to do that and get about our old habit of, you know, walking on eggshells maybe and being polite. And we were not married yet. We were sort of a new couple at that point. So yeah, that happens. So it happened. So it's easy to see how it would be helpful in people already in couples therapy trying to improve their communication. But I also saw people doing it on their own, you know, like boyfriend, girlfriend, and they would or maybe starting to date, they'd fall in love on MDMA, get in a very intense relationship, and it'd just be a astounding failure because they only got along on MDMA.
Right.
And they did not get along in regular life, and they needed a lot, if they wanted to, they would have needed a lot more therapy on their personalities and communication to get that relationship to work. But decided, you know, it's not worth it. It's not working. So there's that danger. And in terms of recreational unsupervised use, you know, falling in love and having sex, and then you come down, and, you know, the coming down of MDMA can be dark and depressing and negative thoughts, you know, the last part of it or the next day. And people don't have a strong relationship, that can kind of go south on them. So
the recovery is a little dark and little.
It can be. I think a lot depends on the person's nervous system. Some people get kind of sleepier, lower energy the last half. But if they're there talking to the therapist, it's going to, you know, that can be a really fruitful period to do some talk therapy to release things. So they're starting to experience dysphoria, discomforts. Because on MDMA, it's like, I don't feel anything bad. There's nothing to work on. You know, so they start to merge in and start to feel the stuff that they were feeling before. That's a very ripe time for deep emotional work and letting go of old ways and old emotional patterns, as that sort of comes back into experience.
So how long does that last?
It's usually about 3 hours of the peak part, and then 3 hours of the lower energy part, and around 6 hours. Mostly, people can tell they had a drug that day, but it's mostly back to normal. Maybe not, you know, sort of physically drained or tired, but pretty much normal thinking and feeling. Yeah.
So it kind of wears out your serotonin or something. It wears out your.
Yeah, it does deplete serotonin. It's all related to dose, and in animals given 10 times the dose, it depletes it. You can measure it, but it doesn't seem to change their behavior. But yeah, serotonin is depleted, and probably dopamine too. It releases serotonin, dopamine, and norepinephrine, and they think the toxicity in animal is more the reuptake of metabolites, thing that the liver is turned MDMA into, gets sucked up back in the neuron and causes problems. So interestingly, the SSRI medicines block that reuptake and prevent the neurotoxicity. So sometimes those are used by people to help prevent serotonin depletion.
Okay.
But yeah, that can be a bummer. It's not, if people do it, every week or multiple doses on weekends, that can be a chronic problem. And I've seen some people like that, but they're remarkably, not impaired cognitively than you would think from taking just tons and tons of MDMA for a year or two. 10 times a normal quantity, over time. Yeah, so.
It's bad for the. So I remember it being years ago, probably while you were still studying, and there were raves going on in New York City, and Donahue had done a show on it. And there was a theory out there at the time that it would deplete your spinal column fluids.
Right, yes. Completely no basis for that. Completely no basis for that. Likewise, no basis for LSD destroys your chromosomes.
Right.
Yeah, but you can see if someone feels down and low energy, like, oh, maybe my spinal fluid drained out, and that's why my energy is low. That's probably how that rumor got started. But yeah.
Yeah. Who knows?
Yeah.
Who knows how that stuff goes. So a lot of mythology that's been kind of out there, and that's really the end fight in almost everything, isn't it? The mythology that occurs at the time in the world you're in.
The fake news. Yeah.
Yeah.
It's hard to sort out.
Yeah. And it's been going on forever. I mean,
oh yeah.
I don't know that we're well-designed people to source information, even though we've got it all there. I don't think that we are taught in our systems, at least in large, to be curious and to explore ideas outside of our realm.
Well, right. And I think that psychedelics allows that. And if people even have basic training, and it does take training in critical thinking, like someone says, well, I think this is true. And you go, well, maybe what's your source of information? What's the logic behind it? All those sort of critical thinking questions. If you're not taught that, or have to learn on your own the hard way, it's not something learned. So, I'm 70 now. When I went to high school, it was pretty guard education. We got into that in college, and critical thought was extremely important. And my father said, you go to college to learn how to think, you don't learn how to career, you learn how to think.
Right.
So I think that's definitely gone downhill in America the last, 50 years. And so people are more motivated by fake news, and they latch on to belief, and they believe it and aren't willing to go to the source of the facts, on both sides of any political spectrum that goes on.
Mm-hmm.
So in psychedelics, the mind quiets, all those kind of belief thoughts kind of are just silent and not, ramming your attention all the time. So other ideas can be considered that are more congruent with the data. And there's actually, this feeds in, there is actually data from a psilocybin study with eating disorder patients, who have this perception their bodies are too fat, in spite of the data of what the scale says or what the mirror says. And with what part of that is this circuit that has their belief is not able to integrate information, sensory information from the outside, like the mirror image or the scale number.
Right.
But the psilocybin, the nervous system is able to more take in that information and adjust the belief, so that we think could be how it maybe helps OCD and eating disorders are kind of like, oh, well, gee, the scale says I'm only weighing 95, and that's not very much. Yeah. That distortion is actually the opposite of what you'd think with a hallucinogen. that distorts more. In this case, it helps remedy distortion the mind is already doing. So that's a very interesting finding.
Body dysmorphia and anorexia. The
Right.
addictions are I don't know anybody who doesn't have some sort of thing they're addicted to, whether it
Yeah.
be work or power or money or food or not food or cigarettes,
Yeah.
or alcohol.
TV, sex, right? You name it.
Yeah. And so we're needy,
Yes, we are. Yes.
needy people. And I don't know how, I mean, it sounds like these help us get there to places where we're not so needy
Right.
and we can be okay with ourselves. And I think that's the end goal, isn't it?
Well, yeah. I mean, the end goal is whatever the person wants, but it's hard to argue that. I mean, who doesn't want to be more happy more of the time?
Mm-hmm.
I mean, I think our nervous system's kind of wired to like, what do you want emotionally? Well, you want to be happy all the time. I mean, duh. We're wired that way. Yeah. So people, if they want to do that, they can learn to do that. But the learning of that can be very hard and involve a lot of suffering.
Yeah,
Getting people to learn how to do that.
Well, I did a lot of work just with, I don't know what they call it, TAP or NLP.
Yeah.
Just talking to myself in a kind way and tapping acupuncture points in the body while going through, some testing to see like what's bugging me. And I did that for a good 8 months or so, and it really helped. I didn't do it with and it helped reprogram the talking.
Yeah.
Self-talking. And then I would stop at a place and go, okay, I've got a feeling. I got a feeling right now, and I feel really upset. I feel really angry, but I don't even know what it is. What is it? So you got to ask that question. What's going on here? And then you find out you just feel guilty because you said something to somebody a long time ago, years ago maybe, and it's still bugging you. And you're like, well, what can I do about it? Can I change it? No. And then you start to move on. And it's so the talking helps. But if you can throw that stuff, put some nitrous oxide in there and kick that.
Yeah. No, right. Yeah. Add some NOS to it. No, I think that's exactly right. And it's not the talking. It's the verbal content, because the processing of trauma, PTSD, involves going from like the midbrain, the limbic system, it's all emotion, into the cortex, which can put labels on things. So you have this intellectual, emotional integration. And until that happens, it's just stewing around in the limbic system, causing disturbances and hyperarousal and intrusive memories and all that. And what you said reminded me of one of my favorite sayings: I'm never upset for the reason I think.
It's so true.
If I was upset for the reason I think, I would just like take care of that reason and move on. But obviously that doesn't happen, because we're upset about something else that's probably from way in the past that we don't even know what it is in the moment. So that process got you to the place where you got to that core feeling, because most therapy, a lot of therapy methods, is getting to the core body emotional feeling.
Yeah.
And when your attention on that, it can relieve and move and be released more than just the thought, which just keeps going in circles. But the body sensation and the pure emotional sensation, that's really the attention that really can help movement. And it takes discipline, to keep doing that, because it's not pleasant to attend to an unpleasant emotion or body sensation.
Mm-hmm.
In the short run. So you have to have a longer range goal and willing to
I find
do that. But obviously it pays off.
I find it's better than letting it cycle, because that's what
exactly. That goes nowhere.
Yeah, and if you can't stop and just go, hey, who are you? What's going on here? Why are you in there? And then work with it. And a lot of times it's your own assumptions.
Usually. Or misunderstandings. Yeah. One of my favorite therapy cards, one frame cartoon, it was inside of a therapist's office. The therapist is slapping the patient, and the title is Brief Therapy. He slaps the patient and says, "Snap out of it."
That's it.
So you pretty much have to do that with yourself.
Yeah.
Like, come on, who are you? What are you trying to do here? Snap out of it. Over and over and over. Maybe you can snap out of it for 2 seconds and then it's going again, but you have to do that over and over and over.
The challenging thing is when they're hidden, when you're like, what's going on? And you don't know.
It's too vague, right?
Something going on, and it's thick. Usually with a little more exploration, you can get there, but not always.
But the psychedelics really help get there because they both, MDMA and psilocybin, lower that whole defense mechanism process. So with MDMA, it's the fear that holds us back. It's like MDMA, oh, well, that's what I'm afraid of. Okay, it just comes much easier. In psilocybin, it's not so easy, but it's possible. It comes, and that's why it can be a problem, because people can have unwanted memories of, say, early childhood trauma or sexual trauma that they never had no knowledge of. And that can be very disturbing. So that's why the therapists need to be ready for those kind of things just to pop out unexpectedly. Because you can imagine, you think you're fine, and then you have a memory of your grandparent, was sexually abusing you when you were 2 years old. That's going to be pretty horrific.
Yeah, and those things define every other move they made in their life at some level.
Right. Yeah, exactly. Yeah.
And their sense of self-worth.
Yeah.
At a real high level, typically.
Yeah.
So how does somebody move on from that? I mean, a lot of people are walking around with those traumas, just looking like regular people.
Yeah. Well, I think most people in this field would say, a psychedelic experience, even with the therapy, gives you an experience and a reframing. But it really takes a practice, some sort of daily, regular practice in daily life to integrate that and to have your daily life improve. And so meditation would be the obvious one for anybody, mindfulness training, because mindfulness training is so helpful during the psychedelic experience to have more skill and ability to attend to the subtle things that are going on. They're happening very quickly. So mindfulness training is good both before and after. And then depending on the person, things like ongoing therapy or whatever, lifestyle changes, diet, exercise, all those things needed to be integrated into every life, because obviously lots of people have had lots of psychedelics and they still smoke and drink and have just as much addiction or depression as before, because they don't have that orientation, that therapeutic support, the skill. The healing is not in the drug. The drug is an inert molecule. It really doesn't care.
Right.
I mean, Charles Manson took LSD and murdered people.
Right.
It's ideologically neutral. So the ideology really is more important or necessary, more importantly than the drug itself, because they can be used in negative ways. Rare, but it can happen.
Well, it's a powerful thing. It's like gasoline. You can put it in a car and go somewhere, or you can light a building on fire.
That's right.
Yeah. It's a matter of purpose.
Exactly. Right. Yeah. Which gets into like, well, what are we? Well, no one else decides our purpose but us. So maybe that's a clue as to who we are. What is my purpose? That's a good question to ask to find out who you think you are.
Mm-hmm.
You may not have an answer, but it's a good good direction to look.
Yeah. Or is there something I need to get out of this that
right
help me get better? Like if I'm going say I want to get over alcohol, that's a very specific goal. And there are methods and patterns for doing that effectively.
Yeah, it's like in the middle of being completely lost and in hell, like, why the hell did I do this? I don't even remember why I'm doing this. It's horrible, and like, oh, I'm doing this to get off alcohol.
Mm-hmm.
Okay, yeah, I want to get off alcohol. So let's sort of gather together and focus, and let's point that direction again. That happens over and over. Mm-hmm. I think in this kind of process, and getting lost, finding the track, getting back on it, over and over and over.
Interesting. The guy who wrote the book, I believe, Alcoholics Anonymous.
Bill Wilson, yeah.
Bill Wilson was a proponent of LSD.
He was, yeah. After AA started, after he recovered, he was a proponent of LSD, but it did not get incorporated in AA because they're against all sort of psychoactive drug use. But no, he was a big proponent. Yeah. To foster that kind of death, rebirth, experience. Yeah.
Right. So I did it when I was younger. A friend of mine was talking to me about it, and so I started reading all the stuff, you know, the Leary stuff and the Lilly stuff and the Aldous Huxley and all of that stuff before I did it, and none of it prepared me for what was going to happen. You know, I'd been involved in religion prior to that point, and I really, it was a heaven and hell experience at some level. But in other levels, it was very beautiful and it was very amazing. But that part, I remember just being in conflict with my own sense of what God was and all of that stuff at the time.
Oh yeah. I think that's kind of that. I had some experience in college, just like, okay, there appears to be no reason to live. Suicide seems just as logical as anything else. It's kind of like no exit place, very mental, but very depressed, down, you know. But then sort of breaking out of that into seeing, oh, the basis of the universe is spiritual. It's awareness, consciousness. It's not, you know, matter. I'm not agnostic. You know, there is spirituality for answers. You know, the mind can't solve problems it created by itself.
Right.
So that was a big breakthrough. That's a permanent sort of shift in perception. You know, I was still just had all the same hangups and neuroses and need a lot of therapy, but no, extremely life-changing. And Shulgin was once asked, well, does psychedelics cause any permanent changes? And his answer was absolutely, just like a higher education.
Yeah. It does really flip how you think about thinking. It's a very meta experience.
Yeah, it can be for some people, not obviously not always, but I had a friend from high school that came back after, you know, in college, and he said, oh yeah, acid, we had that. It was great. We got six-pack and took acid and drove around and looked at the lights in town. It was really wonderful.
Yeah.
Period.
That's
it.
Experiential. Just have fun.
Yeah, get drunk and take acid and look at the lights. That's it.
Yeah, well, there's probably a lot of that. I mean,
tons of it.
The Grateful Dead. That's what happened there. What's interesting is you were involved with MDMA and really had no idea on a therapeutic level and had no idea that it was becoming a rave thing.
Well, no. Well, back in 1980, it wasn't becoming rave yet. It was later. It was. I mean, there was no media about it until 85 that I heard of. So probably was going on, but more underground. But in the media, really, 85 really came out in the media heavy and was shut down.
Yeah, that's crazy. But it does good things.
It certainly can, indeed.
It's good in the fight. Even after it became illegal, did you switch? You had to have switched fields or something.
Well, I just stopped doing it, and then 8 years later started working with Heffter. Yeah, so I did not do any more therapy with anything. Well, ketamine a little bit after that, but not very much. Yeah, so I didn't do other clinical direct work other than a little bit of ketamine work after 1985. More research management with Heffter.
One of the things that keeps coming up is mindfulness.
Yeah.
Really happy to note that it seems to be coming into the corporate world more.
Yeah, we'll see how that changes if it does. But you know, you can be mindful and greedy.
Yeah,
you can be mindfully greedy.
Yeah, well, that's true, and that's probably, if you're going to be greedy, be mindfully greedy, because you'll probably get better results.
Yeah.
Yeah. I kind of wish I had the greed gene a little bit. I'd probably be better off than I am if I had been like a little more striving along that line.
Well, they say successful people have to be a little hypomanic, a little OCD, and a little antisocial.
Oh.
To be successful in business.
Oh yeah. I'm too hypersocial, I think.
You have no greed, you're not going to succeed in business. It's not going to work.
Yeah.
Just give it up, you know.
It's required. It's the superior beings have more greed. That's how we promote it.
Yeah.
I would love to thank you for being out here today. Is there anything else you'd like to share with us?
Well, no, just that I think that in the future, it looks bright in the long run for both patients and just people in general. My personal goal is, way after I'm gone, would be everybody on the planet has access to this experience supervised by a guide, an experienced guide from their own culture and religion, if necessary. That's the ultimate goal, that people have it available, and then all the future sci-fi shows, there's people doing bad stuff. There's always bad guys, blah, blah, blah.
Sure.
But at least I feel this, MDMA and psilocybin, this attitude toward it gives people a chance to move in a more positive direction, which can help human culture, the planet, et cetera. So, it's not a panacea, but it's another opportunity, another path, opens up another path to make things better, that people can choose to go down or not.
Yeah. Well, your goals are right. They're in line, and that's beautiful.
Yeah.
I like what you're doing for the world. I hope that we get more success along these lines with more treatment. I'm a Marine, so I'd like to see, my brothers in arms to get treatment for post-traumatic stress disorder, just addictions in general. I think they're ruining a lot of us at different levels. I know during COVID, alcohol has taken a better stance in my world. It's starting to jump in and say, hey, what about me? So I just said, okay, well, November, I'm going to not drink. And I got a buddy who is feeling the same way. Like it starts to get a little more leverage on you than you want to give it. So
we all need distraction from the pandemic, don't we? It's not fun to live with that thought.
Yeah. So I was just separating my day, like there's the morning and the afternoon where you don't drink, and then there's the evening where you drink. So that's 2 days or 2 parts of a day.
Yeah, right. Yeah.
And I just found I started waking up feeling not great and
exactly.
a little foggy noggin all the time. I'm like, I need to do better than this. Yeah. And maybe I'll go do acid. No. I'd really have been interested in this a long time, this whole subject. If any of your other friends over there at the Heffter Institute or anybody you think would do well on this show, you can send them my way. I'd love it.
Okay, I really enjoyed this. A great discussion with a great depth. So this is I really enjoyed this. Thanks, Gary.
Well, thank you, Dr. Greer. Ladies and gentlemen, subscribe to the Garland Pecker Presents podcast. And if I could say it right, you can subscribe to it. And invite your friends to join. If you want to support it, right now I'm just using support money to make this work. And so there's a little place on the Anchor app where you can say support. And you can actually see it, I think, on your podcast things. So let me say a little promotional thing. So Heffter, we have a website, HEFFTER, Heffter.org. And there are a lot of videos of research subjects talking about their experiences with psilocybin. Yes.
And how they were before and after, that are very inspiring. A lot of cancer patients, and one with alcoholism, a smoker. So a lot of scientific papers, a lot of information. So encourage people to go there. And of course you can donate, money's always good for this work. So
donate.
Thank you.
If you want to see this stuff progress, these research, go watch the videos. They're good. I watched them. I really enjoyed the man who had the cancer, and it just how it changed his life. It was a really good one. I enjoyed that one a lot. I enjoyed all of them, but it's just nice seeing people improved by mindful approaches to things that people are kind of afraid of, but we're actually moving in the right direction.
It is, yeah. It's to know that it's possible. It's very inspiring. Yeah.
Yeah. And I really wanted to get this information out here because I am from Oregon, and we do have a bill.
Yeah.
And I felt like our community, our people here in Oregon, need as much information as possible. So.
Absolutely, especially in Oregon. Yeah, I've been involved with some of those people. Yeah, it's a very complex thing, but you don't have to be mentally ill to have this treatment. Anybody could go under the Oregon model. If it passes, anybody would be eligible to have this with a trained guide from their culture. So that really kind of fits that bill for Oregon. So that's pretty great.
It's wonderful.
Yeah.
This is my first Zoom, so normally I'm just talking and I'm just like, blah, blah, blah. And, I'm closing out the thing. And right now I don't even know what I should do. Like, should I do a dance or a thing? I don't know.
You'll find your way.
I guess I will. That's what this has been. It's been a journey.
Yeah.
Just lost my job in because of COVID after 20 years.
Oh,
And
wow. Okay.
I'm in the process of doing a reinvention. And this is it. And I really thank you for being on here today. I'm to the moon.
Okay. Great. Thank you so much, Gary.
Thank you, and bless you, and have a great day.
Okay. You too. Bye.
Bye. Thank you all. Fuck, are you kidding me?